Mini implant placement. Mini implants are used in order to stabilize an upper denture, and in this instance, we took my patient's dentures, which were very ill-fitting, and because we took some sagittal x-rays, which were x-rays from a side view, and a panoramic x-ray, I was able to use marks in the denture in order to compare them to the x-rays and transfer that information with an indelible marker to my patient's mouth. By doing that, I was able to pre-plan the sites where the mini implants would go while avoiding any sensitive nerve structures or sinus structures. After the marks are made with an indelible marker, we use a small reamer in order to make our pilot opening, followed by a finger wrench, a thumb wrench, and a little ratchet. Right now you can see the wrench being used to gently place the implant to its desired final depth. When we're done, you can see there's no bleeding, as well as the fact that the mini implant ball is sticking up gently above the surface of the gum tissue. Once we place the first mini implant, the mini implant on the other side is going to be initiated, and again the reamer is used in order to just gently penetrate the gum tissue as well as the cortical or outer plate of bone in a very atraumatic way. There's a little bit of irrigation that's used, but we were able to avoid making an incision and sutures. Again, we went through the finger wrench, the thumb wrench, and finally the ratchet or torque wrench is being used to place the implant to the final desired depth. Once it's done and the implants are in place, we're able to place the additional implants in order to give support to the denture. It's very important that the dentist discuss with their patient treatment of both arches one way or another, whether it be with mini implants or traditional implants. Right here you can see the finger driver being used to gently manipulate the mini implant to its proper position. The finger driver allows the implant to be delivered because the mini implants are self-advancing. Again, after the finger driver is used, there's a thumb wrench and then the final torque wrench. These mini implants are wonderful because they provide fantastic retention devices for dentures and partials. As well, there are different heads to these mini implants. There's a rectangular or a ball, and the rectangular mini implants can be used in areas where a traditional implant cannot. For example, if you have space limitations where there's only 4 millimeters of space, a 2 millimeter mini implant can sometimes be used to avoid the need for more expensive orthodontics or reducing the adjacent teeth. Here you can see the third implant is being placed. It's parallel to the other two, and it's going to allow for a wonderful platform on which the denture can sit. The advantage of mini implants is that, according to Dr. Charles English, not only do they retain the denture, but since the forces aren't directed exactly onto the implants and they're retained via an O-ring, there's freedom of movement of the denture in 3 planes. That takes some of the pressure off of the mini implant. As well, since these Imtec implants are stabilized with direct bone contact onto the implants immediately upon placement, it is possible to affix the denture to the mini implants on the day the surgery is done. Sometimes the dentist may elect to put a soft liner in the denture so that the gum tissues can heal a little bit before they go ahead and place the O-ring keeper caps on the mini implants and pick them up with acrylic resin in the denture. As you can see here, my patient is sitting very gently. We've tried in the denture, we've made sure that the denture had clearance, and he was ready for us to pick up the keeper caps in the denture. So once again, we've taken a denture patient and we've turned them back into a dental patient. This is Dr. Richard Winter. Thank you very much.